Hey there, this is KP with Coronavirus Diaries, a channel dedicated to the documentation of a world under lockdown. Today I'm going to talk about asymptomatic versus pre-symptomatic and whether or not they're actually spreading the virus or not. I had a video that I did earlier regarding this, and I think it's a good idea to keep on these types of subjects so that we can see how the science changes, see how the media is reporting it differently over the months, and just keep up on what is current. So right now I'd like to talk about a few stories. First, before we get into the stories themselves, I'd like to just cover a couple definitions. First off, asymptomatic versus presymptomatic. Asymptomatic means that you have no symptoms and you will not develop them later. Someone who is presymptomatic, on the other hand, they have the infection, they don't have symptoms yet, but they will have them eventually. And they might be mild, they might be serious, who knows. Right now, it's presymptomatic. Usually it lasts from 5 to 14 days, that period where you're presymptomatic and you can still spread it. I guess that's really the question, though, is can you actually spread it when you're asymptomatic or not? Well, it looks like the answer is overwhelmingly yes. The question is how much? How much do they actually spread this? And how many people are asymptomatic? Well, that's the real issues, because the percentages, it's such a wide range. It's 18 to 80%. I mean, it's anybody's guess at this point, honestly. This one's a little better, 25 to 80, not much. But we also know that the virus is most contagious before the onset of symptoms. So when you're pre-symptomatic, you're actually most contagious. Another study shows that 81% from a cruise ship showed no symptoms at all. So that's not a good number. Now, of course, this is somewhat anecdotal, of course. It was one cruise ship, but that is kind of a high number there. So why is this all important? Well, because when you are pre-symptomatic or asymptomatic, you are not going to be taking the maximum precautions. You might go to work, you might go out shopping, not realizing that you are spreading this disease. It was a little confusing a few months ago because the World Health Organization's initial statement was that it was very rare to spread the disease if you were asymptomatic. They discouraged the mask wearing, they discouraged social distancing, and it was a very confusing message because a whole bunch of doctors and medical professionals jumped on them for that, and then they clarified it. And they apologized for the confusion and agreed with the medical professionals that yes, indeed, you can spread this. In fact, this story right here probably sums it up the best. People at the greatest risk for spreading COVID-19 are symptomatic people because you're sneezing, you're coughing, but it balances out with the asymptomatic and pre-symptomatic people in that those people that have symptoms usually stay home. They usually don't go out. Maybe they have somebody, a family member or friend that helps them out a bit and picks some things up if they need it. They generally aren't going to be going into work or school. And they're not going to be going out to parties or gatherings if they're actually sick. Whereas people that don't know they're sick and actually are, they're more likely to go out shopping and run errands and whatnot and interact with people. So really what it comes down to is that it's best to assume that asymptomatic and pre-symptomatic people will spread it until more data is in. And in the meantime, practicing social distancing, good hand hygiene, and the use of cloth masks in public places is a good idea, at least until we know what's more about this. The jury is out on quite a bit of this, as you can see. The percentages are very widespread, but it's always a good idea to be cautious, especially when it comes to a new disease that is worldwide. And I think that's about it for this one. Right now, as you can see, 18 to 80% or 25% to 80% may or may not be asymptomatic. We really don't know right now until, of course, we have a lot more testing, even for people that don't have symptoms, but we'll see what happens. Stay safe out there and God bless. This is KP signing off.